My name is Alan Klein. I'm Chief Development Officer at Healthwell, and I'll have the rest of the panel introduce themselves as well.
I'm Joanna Duran. I'm the CEO of Triage Cancer.
I'm Jonathan James, CEO of Hope Charities.
And I'm Fred Lobby, Chief of Operations at Healthwell Foundation.
So today, this is a repeat of a panel that we did last year. This panel is designed to be a collective voice for the patient. We need to know, as folks who are on the front lines, of course, in an operational capacity, what might patients need help with. We think we know, but I can tell you from this meeting last year, there were so many great ideas from the community and from the audience that we actually took a lot of those back at Healthwell and started thinking about whether we can add them to our strategic plan in terms of how we can help patients on a financial level. So what we're going to do now is just give a little background on what we've thought, what we've talked about, introduce our own organizations and what they do a little bit, and then most of this time is going to be left to open up for a conference-wide discussion as to what we should be thinking about, what patients that you've come across actually desperately need financially that organizations like ours may be able to help with. And this is a total wish list, and sometimes we can actually make it happen. But if there's a lot of consensus amongst this community, that certainly lends a lot of credit to any idea that we might come up with. So we'll start a little bit, just give some background on Healthwell. We've, just to, for those of you who may not be familiar with us, last year we helped over 169,000 patients with financial assistance. We received about $678 million in donations. We programmed that out very efficiently thanks to Fred and his team and Krista Zodet, who is our president, with a really low operational overhead rate. And we launched to reopen 16 different funds in 2022. So this is what we do. Most of the time, we provide grants for prescription copayments for both governmentally insured patients as well as privately insured patients. We also help with health insurance premiums, deductibles, and co-insurances. And as you can see, there's a great need for something like this. But in addition to that, while this may be our calling card, we also help with other ancillary patient services, including standard of care, lab monitoring, all sorts of behavioral health services. We had 3 different COVID-19 funds. We have, and still have, 11 years straight opening of a pediatric treatment fund. We have funds helping with just travel costs, and then we've had funds open for vitamins and supplements assistance across a number of different disease areas. And the reason why we spend a lot of time at conferences like these is because of the high number of referrals that we get, and we want to make sure as fast as we get money in, we can get that money out as fast as humanly possible, so we can certainly then go ask for more. And you can see from this slide where our referral sources are. It's from folks like you, for sure, in the audience right now. And we try and hit a lot of conferences that help with a lot of different referrals and a lot of different segments on this, but this conference in particular, with advocates at the front and center, is going to be one of our main sources of referrals and users of our portal. So then I'll pass it on to my friend here to talk about Hope Charities.
Yeah, thank you so much for the invitation to be here. It is my first year at the Healthwell Advocate Summit, and it is a real joy to be with all of you in the room. We've been going to sessions for the last 2 days, and one of the things I find is just it's been so inspiring to be with so many people who are of like mind and are all passionate about serving the needs of patients. As I mentioned earlier, Jonathan James with Hope Charities, President and CEO. My wife and I founded the organization in 2009, really as a financial assistance organization to help people with bleeding disorders, predominantly in hematology. We serve about 10 different disease states now. throughout the hematology space. And we focus really on vital needs at first when we first started. And so we were helping with housing, utilities, food, and things like that. But we've migrated into some other areas where there has been needs, such as copay assistance, as well as premium insurance assistance as well. And so we currently have distributed a little over $2.5 million in individual grants and continue to see growth. One of the driving forces for us behind this was I feel like the hair club for men guy. Sometimes I'm not only a member, I'm not only the president, I'm also a member. But I was born with severe hemophilia, and to date, my maintenance medications for me to get up and come to wonderful events like this and be with you and to drink coffee and be with my family is around $2 million a year just in preventative treatment. As you can imagine, that puts a big giant target on our back. So I'm enemy number one to most payers, and there's a lot of challenges there, constantly trying to get kicked off of various things. But as an organization, that's a driving force of passion for us to be able to serve the needs of the community that we reach and serve. I think we have a slide here of a couple of the programs that we have that really help in about 7 different ways about serving patients in various mechanisms. So this is just the ways that we distribute financial assistance throughout the communities that we serve. These all do kind of functionally do things a little bit differently for each one of these programs. And the next slide, I'll tell you just some of the resources that we provide and the specific diseases that we serve. So I'm really thankful to be here, and it's a real joy and pleasure to be in I feel honored. I feel like that many of you should be in this seat, and we should be listening to you. So thank you so much for having me here today.
Yeah.
You want to talk about resource connection?
Yeah.
Oh, and this is a great slide that I forgot we had. How about that? Awesome. Yeah, this is our Resource Connection program. This helps. So we do, it's funny because you start out, you see a need, and you start trying to help people. And we were just, as a grassroots effort in the very beginning of when we started in 2009, we started helping people navigate a lot of the solutions that many of you help people navigate every day. And so as a nonprofit, we kind of get to do what you guys do, in a nonprofit way. And it's very difficult to sometimes convince the donors that this is such a high need for us to be able to serve the communities that we serve. But these are the various things that we can help, specifically referrals outside of our organization that are not in direct financial assistance. So give you some concept there. Just Social Security disability. Our COO, who's here this weekend, Joe Ferguson, who was with the Social Security Administration for almost 18 years, really helps a lot of folks be able to get capture services wherever they can and really shorten the timelines for those things. Dental programs is a huge need, especially in hematology. There's almost no support there, so we try to do what we can for referrals there, compassionate education, health insurance premium assistance programs, co-payment assistance, medical debt, emergency food, professional counseling, disaster relief, and you can see the rest of the list there. Most of those things are things that we're referring out to try to help people capture those services externally from us, but a lot of case management work that we do. And I'd love to say that we, it always seems like that there's a dichotomy between the need and the demand versus what the supply is. And it's difficult in this space, I think, for all of us to have an abundance mindset over scarcity. It's easy to feel like there's just limitation in every direction that you look at. But that's why we're all here, is because somehow, at some point in time, you are all inspired to fight the good fight and help somebody keep digging and keep digging and keep digging until you found solutions. That's what we do. And again, like I said earlier, it's just a real pleasure to be here with all of you.
Thanks.
I think that's the last slide.
Yeah. Yeah, unless you're working for Triage Cancer.
I
while
would
out
like
here,
to
that is your
also,
last slide.
but I don't know my own slides. I don't know how I can help.
That is fabulous.
So Triage Cancer is a national nonprofit organization that provides free education on the legal and practical issues that come up as a result of a cancer diagnosis. And when I tell people I'm a cancer rights attorney, I always get kind of a funny look. And people inevitably say, well, what's legal about cancer? And my answer is just about everything. So whether or not the Food and Drug Administration approves a treatment is a legal issue. Whether or not the insurance company covers that treatment is a legal issue. Whether or not you get to take time off work to get that treatment is a legal issue. Your ability to replace lost wages by getting disability insurance, legal issue. everything that was talked about in the last session, legal issues. And I actually have to thank Dr. Maddie because I'm usually the person on the stage trying to explain ERISA, and I'm glad I didn't have to do that today. But all of those legal issues actually also have financial impact. And so at Triage Cancer, our goal is to provide free education on those legal issues. So if you actually want to hit the next slide. We provide that free education through educational events. So all of our programs have free continuing education for nurses, social workers, patient advocates, and HR professionals. But we also directly provide education to patients and caregivers. And we have an endless number of materials and resources available to reach people where they are to try to understand how to better navigate the systems. But we also have a legal and financial navigation program where people can get one-on-one assistance with the questions they have about all of these topics and more. And so our legal and financial navigation program gets questions from people in every single state. Patients and caregivers are calling us, but we also have advocates and healthcare professionals contacting us on behalf of patients. And if you go to the next slide, I'll show you, and hopefully the screen will show you, the data of our navigation program, which I will tell you, I've been doing this work for about 30 years, and the legal issues haven't changed. Overwhelmingly, the primary issue that people are experiencing is around health insurance, whether it's getting insurance or navigating it, and then employment and disability, and then finances. So overwhelmingly, for decades, those issues haven't changed. But we do have new terms to describe those issues, like financial toxicity. All of those topics impact someone's finances. And if you go to the next slide, at Triage Cancer, we actually think that the number one contributor to financial toxicity is actually having adequate health insurance coverage. But that's just the first step. You also have to know how to use health insurance coverage. And if you've sat in on some of the other sessions over the last couple of days, we've talked about appeals and the importance of not taking no for an answer and pursuing those appeals. But there are other contributors to financial toxicity that are definitely less discussed. So things like, even if cancer treatment were free, there'd still be a financial burden for people who need to take time off work to get that treatment. There's still a loss of income there. And so figuring out how to make sure that people are staying at work if they need to, or to take time off work if they need to, those are also very important contributors to financial toxicity. And then someone's existing financial situation is going to contribute to their finances, and then life continues to go on besides someone's medical condition. So those life changes that can have an impact on finances also are important for us to deal with. And so ultimately at Triage Cancer, when someone calls us and says, I need financial assistance, we ask why. We want to understand the underlying reasons for why someone needs financial help to see if there's other things that we can do to try to address their financial assistance, both in a crisis moment, but also moving forward so that someone doesn't continue to experience financial crisis. And ultimately what that means is that we don't provide financial assistance. But there are a ton of amazing organizations that do, and we want to make sure that the funds that are available through those organizations are maximized. So that if we can make sure that insurance companies are paying what they're paying and that hospitals are paying what they're paying, that financial assistance can go so much further to help patients cover what insurance and hospitals don't pay for. And so we feel like we are very lucky to partner with the organizations that are providing financial assistance.
Fabulous. Thank you. All right, so you've heard from all of us now, and I can tell you just from last year, we had a really robust discussion with all of you in the audience, and who came up with some outstanding points for all of us to consider. I can kind of harken back to a year ago when we sat on this very stage and folks came running up and said, you're forgetting about the patients who can't afford their copays or out-of-pockets for radiation oncology, for example, so they can't even get onto therapy because their tumors can't be shrunk because they can't afford the radiation to go along with that. And we said, wow, that is something we didn't even think of. So I want to kind of turn it back to the audience now who are on the front lines, and maybe let's start a discussion about what you're seeing out there, and it doesn't have to be in any specific space, but we definitely want to hear from you guys because we get a lot of great ideas about how to program some of our money that we have some discretionary use for from gatherings just like this. So no promises, of course. I can say for Healthwell and most of the others in the Copay Foundation space, the vast majority of the money that we do raise is restricted to a specific disease area and is earmarked for copays and premiums. That being said, there's a lot of fundraising that we do and a lot of other sources of income that we receive that is what we would call unrestricted, that we have the discretion after we talk to our board of directors, for example, to program out in a specific manner. And what I want to do now is spend the rest of our time kind of having that discussion with folks. And I know we have 2 microphones on either side. Hopefully, if anybody wants to start the process, this is the group to listen and facilitate that discussion. So I'll leave it to the audience to get up and start the process. We can start the do you want to start? Do you help with transportation?
Yeah, we do help with some transportation costs. We find this, we do a lot of work in rural health areas where specifically people have a difficulty time getting to an infusion treatment center or even a specialty treatment center that's specifically covering their disease state. We found that basically about half of the people that we were serving over the last 5 years live more than 4 or 5 hours outside of a window to get to a treatment center specifically for hemophilia. And this causes a huge hardship for people because I heard somebody say the other day that even 1 hour is too far away because sometimes the infusion itself only takes 30 minutes, and so the transportation one way is longer than it is for the infusion itself, and so. We do try to provide that. I would say it's been very difficult to find enough resources for that, although it seems that there's a lot of programs that are available, but they're often underfunded and they're also challenging because some of them are so niche to maybe a specific geography. I would also say too that this is an area that we found that relationships with people in different areas has really helped us a lot because being able to find programs and being able to refer people to those programs has been really key because if we can't do it directly, sometimes there's another program that can. There's a lot of local groups that do that, but I would fully agree it's a huge need. I know we're trying to do our part to try to fill that need where we can, but this is something that really takes a lot of collaborative effort because I think the more we have opportunities like this for us to collaborate. I heard somebody say in a session yesterday that they had, it was a health system, and she was talking about how they identified 4 hours away, and there were so many people that weren't coming. They actually started a clinic out there, 4 hours away, and that actually improved a lot of things. So these moments like this really help tremendously, not just close the gap for how to provide more additional programming, but also how to just maybe think of creative ways that we can go to them instead of trying to expect for them to come to us. Because it especially with gas prices today, and I mean, we deal with a lot of folks that don't even have vehicles. So I mean, it's very much a strain on people. That it's a huge need, and so.
Yeah, Fred. Yep.
Yeah, at Healthwell, we do have 3 specific funds. I think the Gout Travel Fund, the Cancer-Related Behavioral Fund, and then what was the other one?
Pediatric.
Say again?
Pediatric.
The Pediatric Assistance Fund. So those 3 funds provide travel assistance, and I'm happy to announce that, in the past, one of the challenges that we had was that patients that were using the travel fund had to pay out of pocket first and get reimbursed. But we were able to partner with a vendor that allows for them to actually call and get the right set up, and then it's applied against their grant, so they don't have to pay out of pocket. And we continue to look at other areas. We're looking at Oncology Travel Fund at this point, and hopefully by next year, this time, maybe we can announce that we have that also open. But so we're looking into that and listening to everyone that has something to say about travel.
Yeah, and I would add that so there's local travel, of course, that's facilitated by that kind of setup, and of course distance travel. And I think our funds are kind of set up to accommodate for both. knowing that there could be times when infusion centers, for example, are not close at all, or there needs to be hotel stays on the front or back end or both to accommodate for the treatment. But if there are ways that you guys think that can be augmented, we're certainly open to listen to that. And I think we're not the only foundation to put some of these funds together. There are other foundations who do that as well. And I know they're in the audience. So if there's best practice sharing that, or additions to those travel funds that are already open, please do let us know either now or just stop by our booth because we are happy to listen to how to augment those. Again, the goal is to make sure that there is no financially gating issues for patients to get their treatment at the end of the day. If they just are able to take all of their medication and their treatment as prescribed by their physician, that gives them the best chance to get better. And if financial obligations are getting in the way of that, that's where we try and other foundations try to step in to make that not a gating issue. So I don't know if you wanted to add anything to that at all.
I think transportation is a very practical problem, and it also, especially when patients are having to travel to treatment, it also creates time away from work or needs for childcare, or if you're also caring for aging adults. And so it's a compounding problem. And so if we can help people get the financial assistance for transportation, that's huge.
We have. Sorry. Hi, my name is. Hi. Okay. So I'm Sarah Hines, and I work at the Cowell Family Cancer Center. It's a part of Munson Medical Center in a rural community in northern Michigan in Traverse City. We have 8 outlying hospital centers that we've collaborated with and partnered as an entity. And I also work on the board for a local transit company. In working with this is a huge issue. We also have a large indigenous area population in our area, and partnering with local transit authorities, the local government, the state government, we've secured grants to partner as a nonprofit center with local transit to get patients from 4, 5, 2 hours away to the treatment center to get their health care. I would absolutely love to continue this conversation with those in the room. This is like my passion. So find me.
Oh,
Thank you.
I will say that for people who are fundraising or tapping into patient assistance programs or crowdfunding, where they're bringing in money, that income will be treated as income for many programs that are based on income level. So whether it's government benefits or financial assistance programs. And so, but there are some ways to actually be proactive about that income. So depending on your patient population, could they have an ABLE account where the money is in that account that doesn't impact their eligibility for programs? Could they have a special needs trust? So there are some ways to protect income so that someone can pay for medical care and not lose access to eligibility for programs that provide assistance.
Yeah, and I like to add that at Healthwell, we adjust for high cost of living areas. So even though we may list the FPL at 500%, it's possible that we may adjust for folks that are living in an area that is high cost. So I would encourage you to, let your folks apply, and they might be able to get access to a grant, even though it may look like they don't qualify.
Yeah.
Yeah, I would just say that my dad used to always say that living with a rare chronic disease, high-cost medications, will make a rich man poor really quick. And so I think that these adjusted cost of living programs are really, really important because it does provide a consideration of what some of the other expenses are. If you live in California or New York, it's just a whole different ballgame than it is in maybe a different location. So I would just say that we got to, I think, stay vigilant on that. One of the things that I think we're running into too is with inflation and the recession pressures that we're all under. I think that there's people are under a whole lot more stress than they used to be, and so we've had, I mean, even this week we've had some conversations about considerations of, instead of 400% poverty level, maybe there's a way that we can lift that to 500%, or instead of 500%, maybe 600%. So I would say that the progress is being considered, but it is really, really, really challenging when you find those people that are just over that limitation. But I know this is a terrible analogy, you have to forgive me, but my dad used to always say there's more than one way to skin a cat. Terrible, I know. But there is, a lot of times there's a way to be able to do something more than one way. And so sometimes we'll find, and I know I've heard Joanne talk about this, is that there's a way for us to sometimes, maybe we can't get it through a copay, but maybe we can go and get it through transportation that doesn't have that FPL limitation. Or maybe we can go through another way that we can get to a different resource that could do it. And sometimes it's just a matter of getting creative. And I would say as advocates, that's one of the reasons why these rooms are so vital, is that, make sure you leave here with 4, 5, 6, 7, 10 business cards, because just reaching out and calling one other person, they may help you just jog your memory of something you forgot about entirely as a resource that might be able to help them in another way besides just hitting it head on. Sometimes you have to go to the side and then still achieve the same result.
Yeah, and I would add, so we actually ran a legal and compliance panel yesterday that Krista Zodet, our president and CEO, moderated yesterday. And we actually got that question, is there a limit on, or should there be a FPL limit, federal poverty level limit, on funds that foundations like ours and all the others should run? And while there may not be a hard and fast limit, I think there is a spiritual limit there, because there's really nothing in our opinion that talks directly about that, but there is some guidance and bulletins that talk about that as an example. And while folks who are over that threshold certainly do have needs, I think the philosophy of a lot of our organizations is we have a finite amount of cash, so we would rather help a lot of people with something than some people with everything, if we can. But that being said, I think there are different ways to address your patient's problem, and I would love to talk one-on-one with you after that. And certainly I would think a lot of smart people putting their heads together probably could make a difference. You're welcome.
I would just add to that too, that elevating these needs is a huge piece to that puzzle, because I think as the powers that be sort of regulate this whole space, I do believe that if we continue to, clang the gong and say these are issues that we're seeing happen in real time, this is how change is actually made over time.
Yeah, that's great.
Okay,
Other questions?
thank you. And I love the work that Hope does. It's amazing. I've watched the evolution from a grassroots movement and taking that and amplifying and really providing some good vocal coaching for those that have lost that voice of hope. So thank you.
Thanks, Chris.
I come from a nonprofit side, specifically supporting women during and beyond a cancer diagnosis. So I kind of direct my question to the bookends here, and it's a two-part. One is I'm seeing with metastatic breast cancer specifically that there is such an ongoing need. And, when someone's originally diagnosed, there's a rush of people to support. And sometimes when people look well in the midst of a diagnosis, or there's no evidence of active disease, there's still so many needs. So I think that's something, if you could address that. And then the second part is having someone that's gone through a cancer treatment. Oftentimes it's the cure that unlocks a whole host of other things. Everything from autoimmune disorders, or specifically, we've tried to support women that might have chemo-induced osteoporosis. So while they're not in active treatment, this certainly affects their quality of life, their ability to, if they, have something where it's the physical demands are lifting past 20 pounds, they're at a great risk for a break, a horrible fracture. So their life, maybe their livelihood, certainly is impacted long after that diagnosis code is not in place. So I was wondering how you all address that as well. So, and thank you again.
Very quick. You want to start? You're welcome. Thank you for the great question.
So I would say anyone with an advanced cancer has ongoing needs that, exponentially financially burden someone and their families. And so I think that for us, that's why it's so important to look beyond a crisis moment where someone needs help or is coming to us with a question, because there are opportunities to answer the questions that weren't asked because they didn't know there were questions to ask. And so to try to make sure that we're treating the whole person, and I, use treat not in the medical sense, but we're addressing the issues all the potential issues that someone might be experiencing. And when someone comes to us and says, like, I'm concerned about work, I'm at a point where I think I need to take a step back from work because I now am on a treatment that is having an impact. We don't want to just talk to them about work. We want to talk to them about disability insurance, and we want to talk to them about their health insurance options. If they're going to have health insurance connected to work, what's their next option? And then, the progression of all the things. So do you have all your estate planning documents in place? So the things that people don't know to ask are the things that we want to make sure they walk away with. And in terms of the financial burden, making sure that even if someone has inadequate health insurance right now, we can fix that in the next open enrollment period for whatever type of insurance they might have. We can fix that moving forward so that as they're receiving ongoing care, because they will be receiving ongoing care, that they're not continuing to experience that significant financial burden.
Yeah, that's a great point. And to add to that, I think, and I appreciate the question so much, treating the cancer is one aspect, and obviously a very important aspect, but that diagnosis does lead to other different scenario issues. What we tried to do as an example that we put together several years ago is we found out that up to 30% of people who are diagnosed with cancer, because of their diagnosis, they are then subsequently diagnosed with depression or anxiety and never get on treatment or decide that they can't move forward. So we didn't want that to be a gating issue. So we did open up a cancer-related behavioral health fund to address that and to pay for out-of-pockets with regard to any medication for depression or anxiety that a cancer patient might need, any talk therapy issues, copay for that, as well as transportation. And to be quite honest with you, we haven't been able to give that money away fast enough. We are sitting on a amount of money where I wish I could program that out faster. So if you have patients that could avail themselves of that,
I could help you with that.
thank you. Come talk to me. I'm at the HealthWell booth for the rest of today, and we'll make that happen. So thank you for that.
I do just also want to say that none of these issues are specific to the cancer community.
Right.
And so they apply to every patient, to every person. And so understanding how to navigate the system and to get access to the care that you need is a issue that is cross-cutting. And to that point, Triage Cancer rolled out a program called Triage Health this summer so that all the information and resources that we have available don't say cancer on them, so that anyone can access it and feel like it is applicable to them.
Fabulous point. Thank you.
We have about 5 minutes, but everybody can find HealthWell and all the other organizations, so we're going to let just a couple more questions.
The point you just made about all patients, that's really what I'm coming up here for. I hear it a lot, and we've seen it in policy work that's been done, non-med switching and diabetes. The disease state sometimes gets in the way of helping all patients. And my question is, why the disease state delineation for transportation or social determinant of health issues, health equity issues that really require listening or hearing and helping all patients rather than just those in a specific disease state?
That's a fantastic question.
Yeah, great point. Oh, you want me to start?
I think you're the best to answer that, Alan.
So actually, that's a great question. Thank you for that. As I mentioned, some of our disease state funds are restricted to those disease areas, but when we open up a fund with unrestricted funding, those are broad, non-disease-based fund for the most part. For example, as Fred mentioned, we have a pediatric assistance fund that will help anybody who's under 18 with any disease. We are agnostic to the disease. We have a health access fund, same thing for other costs there. So these are all on our website. While you'll see the majority of the funds on our website focused on a single disease area, please do talk to us. We are trying to help anybody and everybody we can under the auspices of the regulatory issues that we have to maintain and follow. So coming to us and talking to us, I think, will probably be the best thing. We try to say yes to everybody, but I also want to let others talk through that as well.
I would say we at Healthwell, we recognize that we're in the space of helping with financial assistance, but we recognize there are other needs. And so we have built alliance partners. We have alliance partners. So as patients come to us, we look for ways to refer them elsewhere, including triage cancer and all other places. So that's how we're looking at trying to solve the problem now. But I think it's good to look at when we can have a fund that helps everyone.
I would just add to that too, that I think that the solution is in the relationships in this room. I think this is part of the reason why we engage with many different disease states and many different organizations, is because there are solutions that are, that other people are working on. And I would say, I mean, maybe a little more plain or straightforward, is that sometimes the funding is what is really, unfortunately, it's just very, 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 very difficult to fundraise for each one of these things. And the donors that want it to be disease specific, it just has to be. But, I would say that we're all doing our part to work really hard to try to meet those needs in other ways. Our Resource Connection program that I mentioned earlier is disease agnostic as well. And so we really, I think all of us recognize that that's a thing. But, it's just like in any business, you have to choose your path. I think the same question could be posed to why a Snowball stand. Well, we didn't think that, Creole cream cheese cheesecakes was going to be the best seller, so we just went for Snowballs, and I think at some point you have to choose a path and stick with it, be focused on it, be really great at that one thing. So there's sort of this tension that we all have to manage, and I think, but I would say that the solution is found in this room.
Yep.
To that point, I just want to say, you mentioned advocacy. The advocacy efforts shouldn't be disease specific. The issues are cross-cutting, and there are a lot of allies in other areas that can contribute to advocacy work that has an impact on all patient populations. So things like paid family leave, that there's an entire, advocacy effort around paid family leave that has nothing to do with the medical condition. There's housing issues. There's all the social determinants of health that have an impact on health, where there's opportunities to work with housing groups and legal aid associations who are working in communities. So there's a lot of potential for relationships and alliances to advance advocacy efforts that have an impact on all of us.
Right.
Hi, and thank you for being here, and thanks for asking the question about gaps in resources. Okay. One area that has been a real big problem throughout my career in nursing and advocacy is getting help at home for folks who can't do chores. They need help with ADLs. They need help with transportation to appointments. And I'm not talking about the actual transportation, but they need a person to take them. Obviously, there are a lot more resources for seniors, but still that area is a problem. So you had mentioned, where are the gaps in resources? I think there's a really big gap for younger patients as well, because there aren't those senior resources at their disposal. I had a client who has a genetic disease that's debilitating, and she has a partner who is helping her now, but that partner won't always be able physically to help her. And she's trying to plan for her future, she knows she's going to need this type of help moving forward. But her disease struck her so young that she never even was able to get a work history. So She's not able to get some of those benefits she would get if she had a work history. And she looked into getting long-term care insurance to pay for some of those costs down the road. But since she already has this disease, she's ineligible for that. So she really has, there's nothing. And so I think that's just a really big gap in resources. And I know it's a large cost and long-term cost. So I know that's a challenge. But if we could figure out some way to meet that need, I think, I can't even imagine how many people we could help. So I don't need an answer. I know we're running out of time, but I just wanted to throw that out as something that we should be trying to address.
Thank you. That's
Thank
very
you, yeah.
important. Well said. I think I saw a note that we're out of time, and I definitely want to stay on Melissa and Liz's good side. So, because I've been on the bad side, and I don't want to go there ever again. So thank you guys very much for being a great audience. And again, let's continue the conversation whenever you guys are able to do so. Thank you.
Thank you.